white blood cell disorders, which is mainly what we're going to do is leukemia. Okay? But just a couple of definitions. Leukopenia versus leukocytosis. Again, words are going to help you. Leuko meaning white, so we're dealing with the white blood cells. Leukemia is a decreased amount. Cytosis is an increased amount. Okay? So just putting that, it's a new medical terminology. So leukopenia is a decrease of white blood cells. And we can have other words there. It's going to be less than 4,000, and some books it might be less than 4,500. So you've got granulocytopenia, neutropenia, lymphopenia. Now, here's a little thing about neutropenia is decrease of neutrophils, right? Decrease of lymphocytes. If you have a decrease of lymphocytes, think AIDS, right? Because HIV kills what? Remember? Yeah, but what particular ones? What lymphocytes? Helper T cells, which are lymphocytes. So lymphocytes change into B cells, which make antibodies, or they change into T cells, and T cells could be helper T cells, killer T cells, suppressor T cells, memory T cells, so they can turn into it. But what HIV kills is the helper T cells. So if they kill that, then your lymphocytes are going to go down. So if you have lymphocytes that are decreased, I'm not saying is AIDS, I'm just saying think AIDS. Okay? Then we have leukocytosis, which means we have an increase of white blood cells. And we can have granulocytosis. So this is white blood cells that are greater than 10,000. Okay? We have granulocytosis. The other suffix that also means an increased amount is philia. So sometimes you'll see neutrophilia or neutrocytosis. It means the same thing. Okay? Eosinophilia. Like if you have an increased amount of eosinophils. Okay? In that case, think of parasitic worms. Right? Because eosinophils increase during parasitic worms, usually worms that are in the bloodstream, and also allergies. So people with asthma, right? If asthma attack, your eosinophils are going to go up because of that. Right? It's an allergy on there. If you have an increased amount of lymphocytes, well, lymphocytes are going to seriously attack viruses. So if you have an increase in lymphocytes, think viruses. Again, it's not 100%, but it kind of puts that, rule of thumb on there. So that's if white blood cells are greater than 10,000. If white blood cells are more than 50,000, think leukemia. And that's what we're going to talk about now. Okay? All right, so let's talk about leukemias. All right? This is cancer of the white blood cells. And here's how the nomenclature is. We could break it down into two things. And I'm going to show you the next slide is basically how a white blood cell is formed. And you got to go through the stem cells to see that. So let me just explain to you here, and then the picture will make more sense. So we could either have leukemias that come from a myelocytic stem cell, or you could have leukemia that comes from a lymphocytic. So it's either coming from the myeloblast or it's coming from the lymphocytes. So I'll show you what that looks like on the next slide. But the other way is once you find out if it's coming from which origin, then we can talk about is it an acute leukemia or chronic. In acute leukemias, these are primarily affecting children, and they are more blast-type cells, okay, so early immature cells. They are acute because they usually have a set of symptoms that happens abruptly, quite quickly when this happens, okay? Usually they will have an acute infection or hemorrhage, and we'll talk about why they get this if it's the white blood cells that's having the issues here. We could also have chronic leukemia, and this is usually more in the older patients. So what we got here, this is a busy slide, and if you go back to the first 35 slides, it kind of shows you a little bit more detail about this. But this is just the white blood cells. I think in the first 35 slides, it'll show you where the red blood cells come in and where the platelets come in. But we just kind of cut this to the chase for the white blood cells. All the cells that come, that give rise to the red blood cells, white blood cells, and the platelets come from one stem cell called the hemocytoblast. From there, it'll make the red blood cells. From there, it'll make the platelets. Make karyocytes to make platelets. We're just kind of concentrating on the white blood cells. From the hemocytoblast, you're either going to make a myeloid stem cell or a lymphoid stem cell. The lymphoid stem cell is going to eventually make the lymphocytes. The myeloid stem cell will make the eosinophils, neutrophils, basophils, and the monocytes. Okay? You don't have to worry about all these different steps in here. That's not what I put that up here. But understand how it's being broken down. You have a lymphoid kind of leukemia, or you can have a myeloid leukemia. Okay? And it can be acute or chronic. So, let's talk about, and I just picked certain features, but this is where you have to look into the book because it's just too much detail. But I picked out certain features that actually will stand out to help you cipher between the four major types of leukemias. Okay? So, first one is something called acute lymphoblastic leukemia, which is also referred to as ALL. This is the most common leukemia in children. All right, this is when we have immature lymphoblasts that are being made. 75% of the children are cured. However, this is the most common cancer-causing deaths in children. So it has a good prognosis, but of all the cancers in children, this is the one that kills them the most. Okay? Then we have acute myelogenous leukemia. And this is where we're going to have immature myeloblasts and myelocytes. Think of how that's being split from that picture I showed before. Smoking is a risk factor. This is very aggressive of all the leukemias. If there's no treatment and they're diagnosed, they usually will die in 6 months. Okay, so this is very aggressive. Then we have our chronic ones. We have chronic lymphocytic leukemia. It's also referred to as CLL. This is the most common leukemia for people who are over 60 years old. This is the increased mature lymphocytes, but they're just abnormal in shape. This is probably one of the slowest growing cancers that we have overall. They could live up to 20 years after they're being diagnosed without treatment. So that's what's happening with this. Then we have chronic myelogenesis originatus leukemia, or CML. And this increases immature myeloblasts and myelocytes, and there's also mature cells there also, but they're just abnormal in terms of the neutrophils, eosinophils, and basophils. One thing that really stands out about this, these little pearls that'll help you, they'll pop up on, let's say, NCLEX and other exams. This has something called a Philadelphia chromosome. And basically what happens is there's a piece of chromosome 9 that comes off and gets translocated and gets put onto 22. And there's a place of 22 that goes onto 9. So it's this translocation. Whenever you see words like Philadelphia chromosome, leukemia, you see words or numbers like 9 and 22, think of CML. These are little pearls that are going to just pop up. And when you do case study questions on NCLEX and stuff, you see these words up there, you have an idea what they're asking. Okay? So those are the 4 different types that I want you to know. There's a few other things in there if you're confused about what I'm writing on here from the book, but those are pretty much what I want you to know about leukemia. Okay? So what happens to these leukemias overall? Well, in the bloodstream, you're going to have a lot of immature or abnormal white blood cells that are found in all the leukemias. And what happens here is that the white blood cells are being formed in the bone marrow. The bone marrow is making these white blood cells, but they're making them abnormal. And what's happening here is, think of it like, I kind of tell my A&P 2 students, is think of it like in a police academy. A police academy, I don't know how long it takes for someone to graduate the police academy, if it's a year or 2 years. But let's say it's a year. So you're going to have people coming into the police academy, and then they graduate after a year, and then they're full-fledged rookies, and they can fight crime, and they're full-fledged rookies and police officers, and they're doing their job. But let's say we want to make them come into the police academy, but we want to graduate them in 2 months. Now, there's a lot more rookies out there and police officers now. The only problem is they're not functioning. They're immature. That's what's happening with leukemia. Leukemia is that most of these are either abnormal or immature. So you're putting a lot more white blood cells out in the bloodstream, but they're just not functioning right. All right, they're immature. They're not fully graduated, so to say. But what's going to happen, this is what's key about leukemia, and it makes sense about the signs and symptoms, is that in the bone marrow, the white blood cells are being formed, but they're being abnormally formed, and they're starting to overcrowd the bone marrow. So now, the other things that are happening is that in the bone marrow, you are going to have loads of these cancerous white blood cells that are filling up the bone marrow. But keep in mind what other things are supposed to be made in the bone marrow. You're supposed to also get platelets being formed and red blood cells that are being formed, but they can't, because when they divide, there's no place for the cells to go because there's too much white blood cells there. They're overcrowding the bone marrow. So here's a person who's got leukemia, and the white blood cells go out there. They have an infection, but they can't fight the infection because the white blood cells are immature. But do you understand why they will have hemorrhaging? Because there's no platelets. You see why they're anemic? Because there's no red blood cells. So even though it's a white blood cell disorder, leukemia, you will get signs and symptoms of anemia and thrombocytopenia. So you got to think of it all together there, okay? So white blood cells are produced, though there's a lot of them, they don't function. So they're going to have a lot of infections, okay? So this is what a normal blood smear would look like, all right? So you have, one field of view, you may see like 2 white blood cells there, and the rest are going to be red blood cells, okay? In a person who's got leukemia, in this case CLL, it's different. You see that there's tons of white blood cells there. Big, big difference. And they can just do that with a blood smear. They might have to do a bone marrow biopsy and see what type of leukemia it is. So that's how that happens there. Okay? So signs and symptoms make sense. Like I said, you don't have to memorize it if you just understand the concept. That you're going to have an increase in infections, you're going to have easy bruising, so you're brushing your teeth and blood is coming out of your gums. They may have unknown reasons why they have a bloody nose. They may just hit the board up there like, wow, why am I bruising so much or so easily? They may have petechiae that's located all over their bodies, ecchymoses and all that stuff. You'll also get anemia. So it's a whole brigade of things going on, okay? So death is usually hemorrhage or overwhelming infections, all right, for obvious reasons. You'll be anemic too, but you won't die from that so quickly. You'll usually die from these things, okay? Treatments, you either eradicate the area with radiation, any kind of treatments that we talked about with chemotherapy, bone marrow transplant.